the general management plan, there were 35, and then more were translocated, and I'm sure there's maybe over 50 or 70. So the thing is, we learned is that once translocations work. This was an era where conservationists didn't want you to touch animals, and everything was just a test. But now we all know that translocations works. Translocation is a very good conservation tool to boost populations and bring them back to what they used to be. So taking you now to Bwindi, where I first went as a vet student in 1994. In Buhoma, this is where I started out when this population had just been discovered a few years earlier, and research had started, and now tourism had just started in '93. And one of the first cases I had to handle was a skin disease in the gorillas. Dr. Richard Cook, who's in the photo here with me, came. He just happened to be in Uganda for another reason, to try and see the vet needs of UA, funded by World Bank. I remember this time round, he came, and I said to him, Richard, we have an emergency. Can we first go to Bwindi and deal with the gorillas? They're losing hair and developing white scaly skin. Because before that, I tried to use Captain Otekat's vehicle as a Deputy Director of Field Operations, and he broke down in Impiji. So we had to come back. And Richard Koch, Dr. Koch had a brand new Land Rover from World Bank. Imagine. And I was like, okay, let's sit in this land. It could only drive maximum 80 kilometers per hour because it's brand new. They can't go beyond that. So we went with his Land Rover to Bwindi, and he helped me out in this, and it was very good to have him there because he had ever seen such cases in cheetahs in Masai Mara. And cheetahs in Masai Mara were those that were visited by very many vehicles, had sarcoptic mange or scabies, and those that were not were okay. So he attributed it to stress. And when we got to Bwindi, this gorilla family had gone down to 4 gorillas. Some of them had gone to Congo, DRC, and never come back. And so we were able to treat them. This gorilla was scratching even under the anesthetic, the ketamine, and the mother wouldn't allow us near the baby, which was worst off. But a few days later, she dropped the baby. Actually, the next day, she dropped the baby. And so we were able to get a fresh postmortem, because when you have a fresh postmortem, you can do a lot more. And this 2-month-old baby was then, we did the postmortem, and the mites were still alive after the baby had died. You can imagine. But the rest recovered with ivermectin. Unfortunately, the group eventually disintegrated, so it's no longer there, the Katende Jure group. And so we asked, where did they get it from? Where could they have got it from? As you all know, this is Bwindi landscape, surrounded by cultivation, hard edge, almost all over the park. And these gorillas like to eat banana plants. They used to find them inside the forest, and now they're finding them outside, and they go to places that they used to range before tourism had begun. And now that they lost their fear of people, they could go out back to those places. So this is a big problem. Human-wildlife conflict leads to disease, and they found dirty clothing on scarecrows and got sick. And that's how they got the scabies. And so this made me think that you can't really protect the gorillas without improving the health of their human neighbors. And a few years later, we founded Conservation Through Public Health. But just before leaving UA, everybody turned to me. Stephen Asuma had now just joined IGCP, having left UA. And there was a workshop about ecotourism, and everybody said, but the gorillas have picked up scabies, they're going to pick up other things. People openly defecate, they leave their rubbish heaps open, and they turned to me, being the only vet in the organization at that time, because in vet school you get training in public health. And they said, you need to lead these health education workshops. And so that was a turning point in my life, and we developed these brochures in English and the local language and went to the communities. And that's when they told us that we are tired of this wildlife coming into our gardens, your wildlife. I didn't realize there was a lot of tension between the community and the park. And so, but the good thing is, having told them what the problem was, they came up with very good solutions of what we can do, some of which we used to start the NGO a few years later. They wanted health services to be brought closer. People get sick, they carry them over steep hills, and by the time they get to the health center, sometimes it's too late. They carry them on a stretcher. They wanted more continuous health education, and they wanted to strengthen the HUGO members, the community volunteers, who had gorillas back. And as long as people are poor, like these little boys who are supposed to be in school but were herding goats, the people will suffer and the wildlife will suffer. So I went and did a zoo medicine residency in 2001 and 2. Actually, I traveled in 2000, and I was able to come back and do some TB research in people, wildlife, and livestock. And of course, over there, they have very sophisticated machines for treating animals, but I was able to learn a lot from them. And we came back and did TB research. Actually, after the first year, I got married. Lawrence and I got married in Uganda, and he became the first donor to CTPH with $100 and $100 from me, and we founded the NGO in America. So this study design really looked at, I'm going to talk about how this research study led to some practice and policy change. We were looking at TB in people, livestock, and wildlife. So it was actually a One Health study. This was before people used to call it One Health. And for the people, we just looked at people who were coughing with chronic coughs, both around Queen Elizabeth National Park and Bwindi, and then just the park staff, because they go near the gorillas a lot. And we did some questionnaires. And Queen Elizabeth National Park was very interesting for me, because the people there did not like UA at all. I hope it's changed. Has it changed? Oh. UA, has it changed?
It's improving.
It has improved. Eh? Very good. Oh, John is here now. Nice to see you, Mr. Makombo. You remember those days? So when we interviewed them, they told us they complained about UA, so many bad things about UA, and but it was good for me, because having worked in UA, I didn't know how the community feels about the park. In Bwindi, I had an idea because they liked the park, but in Queen Elizabeth, they hated the park. They wanted to go back in and graze. They don't believe that the wildlife, that their cattle can make the wildlife sick. They said, in fact, it's the wildlife making their cows sick. They said, then don't graze them in the park. They said, but that is our park. So it was a very good experience for me in Queen Elizabeth National Park when we interviewed people. In Bwindi, people were much more willing to listen to what we had to say, but everybody said they're very happy to eat an animal which has died. They don't know what it's died of. They'll say Christmas has come early. And they're also very happy to drink milk from any cow anywhere, because they don't think it can make them sick. So all of this exposes them to TB. It was very difficult to get samples from their cows in Queen, because they didn't trust me, because they said, I've come from UA, what if I'm come to do something to their cows? But then we worked closely with the district veterinary officer and sub-county vet, Dr. Kalule and Dr. Tumushabe, and we were able to take samples from them. And so this is what we found in the people. We found that the Queen Elizabeth and Bwindi community groups did have TB, quite a bit of TB in the chronic coughers. These were the chronic coughers who had TB. Whereas in the park staff did not have TB. Most of them did not have TB. So the chronic coughers had between 20% and 30%, and the park staff, we didn't really find any. But this helped us then this is how the TB looks under a microscope. So this then made us realize that the community-based direct treatment of TB needed to be instituted in Bwindi. Because we saw it in Queen Elizabeth National Park. People would say, this is the volunteer who watches me taking medicine every day for 8 months until I'm better. And I went in 2001, I thought somebody was going to die. I came back in 2002, he was very okay because of CB dots. In Bwindi, those people didn't exist. And in 2001, I saw people saying, we can't go back all the way to the health center, it's too far away. And I'm feeling better anyway, but they were not fully better, because you have to take it for 8 months, the medicine. Otherwise, you develop drug-resistant TB. In 2002, those people had died. So I realized that this is very, very important. And if it gets to the gorillas, it's even worse, because you can't treat gorillas every day for 8 months. It's impossible. They will just become dehabituated. Also, an employee health program for park staff was recommended, so that you can test them for TB and other diseases before and treat them. But one thing that they do in the UK is that they cull cattle which have tuberculosis, and they pay the cattle owners, because once there's a cow in a herd, it's going to spread it to all the others. We tried to introduce this to Ministry of Agriculture, but they didn't buy into it. And because of this, it's going to be very difficult to manage such diseases in livestock in Uganda, but something that they need to look at. And I'm glad that now the National One Health platform is here, and hopefully such things can be understood better by all. So Bwindi National Park is still, there's still many steep slopes, there's very hard edge between the community and the park. And the biggest threats, actually, habitat loss is a threat, disease is a threat, poaching is more of a threat for other animals like duiker or bush pig. But if gorillas happen to go to neighboring countries, they could get eaten, where it's okay, where you believe that you can eat a gorilla, you can become as strong as a gorilla. And actually the batwa, I realized, really did not disrupt the gorillas. It was bad luck for them to look in the eyes of a gorilla, and they told me that we can't eat something that looks like us. So at least we know that the local communities in Bwindi don't do much poaching at all. So we founded CTPH in 2003. That's the view from our office, for those who haven't seen it. I know some of you have come already, like Dr. Caro and many of you here. Mr. Makombo helped us to set it up when he was the chief warden. And we have 3 integrated programs: wildlife conservation, community health, and alternative livelihoods. So these are the programs that we integrate. We started livelihoods later when we found out that many people are unhealthy because they're poor. And for example, we did a survey and we found that people with temporary and semi-permanent houses had the worst health indicators. They didn't have hand washing stations, they had more diseases, and so we felt we needed to improve their livelihoods. And Lawrence came up with the idea of gorilla conservation. And so we trained rangers to monitor the health of the gorillas, and we're happy that within a year or two, this became part of the UA Bwindi Mugahinga Conservation Area Annual Operational Plan. The rangers go out and collect samples, and then they're analyzed. So it's not considered a research activity, it's considered a general day-to-day monitoring activity, which is very good, because it shouldn't just be standalone research. A lot of this should be integrated, and we're glad that UA has taken that direction. So we started off with this temporary shelter, and that's the US ambassador to Uganda at the time, Steve and Sue Browning, and Stephen Rubanga, our 3rd founder member, was giving them a talk. That's Moses now at ITFC. And then later we upgraded to a permanent place, a permanent building with support from Task Trust. And that's Stephen training some researchers from UK. And so over here, the gorillas still come out of the park. We still see this happening. And it's not going to get any better because the numbers of gorillas are growing, which is very good, thanks to UA and several NGOs and private sector, but the space for the gorillas isn't growing. There's a black buck coming out in the southern sector. And so one thing we found is that the parasite burden in gorillas in southern sector was higher than northern. So we talked to UA about it, and they recruited many more Hugo members in the southern sector. And then the parasite burden dropped later on. So that's something that actually monitoring can lead to changes. Research can lead to changes, as long as the relevant people are informed in time and they're willing to make those changes. And so we continue to monitor the animals, we continue to monitor the gorilla groups, and we are finding that over time, because community health is improving, in areas where gorillas come out, some human-related infections are dropping. And they've dropped almost by half from 2024 to 2025. The parasites, the human-related parasites, Ascaris and Trichuris, which is something we're happy about. Now there's 27 habituated gorilla groups. At the beginning, there used to be 2. And so gorillas also share water sources with people and their livestock. This is a microhydro dam built with support from GIZ. And because they share water sources, they can make each other sick. And so we looked at diseases that they could be getting from the livestock or from the people. We worked with a student from UC Davis. At the time, he got some free kits that we used, and we published a paper in Frontiers for Public Health, together with the head of Bwindi Community Hospital at the time. He was also a co-author. And we found out that the areas where there were many community volunteers, gorillas were not getting sick, and those where they weren't, they were. So we started to get more community volunteers. These are village health and conservation teams who make sure people are healthy and hygienic. So the areas where there was very bad indicators, the gorillas were getting cryptosporidium and things like that. And also, we even trained the cattle farmers to give cattle water troughs so that they don't have to defecate in the same places where gorillas and people are getting water from. So human-wildlife conflict continues, and we train the gorilla guardians to also collect samples from the nests as well. We work with village health teams and train them to do conservation work. Because we do a lot of health work, half of our volunteers are women and half are men. So we're engaging women more in conservation and men more in public health, which is very good. We started off with 26, now we have 430, reaching over 50,000 people in over 10,000 homes. We added family planning. You may wonder, what does family planning have to do with it? Conservationists? Actually, some conservation groups had started doing it, like the Jengudo Institute in Tanzania, with Takari and some World Wildlife Fund and CI in Madagascar. And why? Because people told us, Mbara University students did a surveys before we started this project, and they found out that people would tell them, we have 10 children. Half are for going to school, the other half are for chasing wildlife from the garden. So those who don't go to school will never have a future. They'll still be entering the forest to poach and collect firewood, because they won't have gone to school and they won't have got another job, and they'll just be depending on the land. So we started this flip chart of the bad family, which has doing many things wrong, and then the good family. So when the gorillas come out, they try and chase them and they get harmed, whereas the good family, they have 4 children. When the gorillas come out, they call out the Hugo members to herd them back. And with the bad family, eventually you get teenage pregnancies, early deaths. They're arrested by rangers for poaching, and there's a lot of domestic violence. Whereas the good family, they all go to school, girls and boys, they graduate, they have a graduation party. So all of that makes a big difference. And we worked with a lady called Dr. Lynn Gaffikin, and she convinced us to link up with Family Health International to see, because they were promoting the feasibility of community health workers giving injections, because you find that the most common contraceptive in Uganda was the injection. Because what would happen, if they took the pill, their husbands would sometimes say, why are you taking the pill? Why aren't you having babies? Now that's another issue that we dealt with at CTPH as well, through couple peer education. But with the injection, they silently go to the health center, they get their shot, they go home. They don't have babies, and it's okay. Unless the husband now starts saying, why aren't you having babies? And there's domestic violence. But we found out that they really liked the depot, so we trained people to give depot in the comfort of their home. We're among the 5 pilot sites that FHI worked with, and they invited us for the research to policy engagement by Ministry of Health in Kampala, in one of the hotels in Kampala. I was so excited to see it became a policy change in Uganda, and in other countries they work in Africa with Kenya, Green Belt Movement, and so many other places. So I found that the public health sector is very good at changing research interventions into policy, and I was very excited about that. I was very inspired. So through our work, we've helped to advocate to the government for a national PHE network, which is headed by the National Population Council under the Ministry of Finance and Planning, and then the National One Health Platform, which rotates. It consists of Ministry of Tourism, Ministry of Health, Ministry of Agriculture, and Ministry of Water and Environment. I don't know who the chair is now. Is it Water and Environment? Yes. So this National One Health Platform is really bringing everybody together. In 2010, this master student wanted to interview tourists to see if they're willing to wear masks. So we hosted her for that. This was 10 years before the pandemic. We're glad that the gorilla numbers kept growing with all the successful interventions, and they stopped being critically endangered in 2018. And the newborn babies keep coming. Well done, everybody. And this really inspires all of us. So gorilla tourism is one of the top activities in East Africa. Actually, the 4 main tourist destinations in East Africa are Serengeti in Tanzania, Masai Mara in Kenya, Volcano National Park in Rwanda, and Bwindi Impenetrable National Park in Uganda. Can you imagine? So I think Uganda, we've done very well. Those are the 4 places that tourists go. Once they've decided to go there, then they plan the rest of their holiday around these 4 destinations. And so these were the days when the older UA Park headquarters, people would be told to stand 7 meters away, and the rangers giving a talk. And here they're standing 7 meters away. I think this was David Agena. A student we worked with did some research and found from University of Ohio University, that 60% of the time, okay, first of all, the rangers, 98% of the time they told people, you shouldn't get close to gorillas. They told the tourists. But 60% of the time, tourists got too close, and 40% of the time, it's the gorillas that broke the rules, and they got even closer than 3 meters. So when the pandemic came, we were very, very concerned, and we found out that we needed to do something. And immediately, mask wearing began. This is the beginning of the pandemic. I can see Joseph Arinete was the research, ecological monitoring. He's over here. And everybody embraced it because of all these research studies. And it was a very scary time, if you remember. And then we realized that responsible tourism always has to involve mask wearing. This is someone who went to see the gorillas. He was from German TV when it had just opened up, end of September 2020. And I encouraged him to buy a craft from the community member, because this is what they need to do. If they meet a tourist, they're less likely to poach. And so we put this into a policy brief together with the Africa CSO Biodiversity Alliance, which is supported by African Wildlife Foundation. And we launched it in Rwanda at the first Africa Protected Area Congress. It was both in English and French. It was written together with International Gorilla Conservation Program. We co-authored it and launched it in English and French, because can you believe it that there are 13 countries in Africa, 21 countries in Africa have great apes, gorillas and chimpanzees, and of these 13 have great ape tourism. So we are not the only ones. But we are the farthest ahead. Uganda is the farthest ahead, Rwanda, Tanzania, and then the others are following. So we wanted everybody to follow the same based on our experiences here in Uganda. And when we launched it, we had two tour operators, Praveen from Volcano Safaris and Manzi from Wilderness Tours. And then the head of Rwanda, Deputy Director of Rwanda Development Board at the time, and then Nelson Guma, who was the Chief Warden, and also Dr. Emmanuel Normand, who was heading Chimpanzee Conservation Foundation in Ivory Coast. So it was a very great event, and we want all the countries to follow this. We hosted the US ambassador, the former ambassador, to Bwindi, and she became a big advocate for mask wearing. And you may wonder why there were so many people visiting the gorillas that day. She was surprised that none of her staff at the embassy had ever seen gorillas. And she felt, her Ugandan staff, and she felt it was very important that they do. So she drove to Bwindi with her team, and when we went to the park and entered to trek with the chief warden and tourism warden, Robina, it was half. Half of us saw them, then went back, and then the other half, because it's 8 people per group per day. And she became a very big ambassador for us in that area. We also took the Namagereka for the second time. The first time was in 2005 when we launched CTPH programs, and she became the first queen in the world to trek mountain gorillas in the whole world. Can you believe it? Here in Uganda. And then she came back for our 20th anniversary when we also opened the other center, and now she was wearing masks. So when we get leaders like that doing the right thing, everybody else follows. And she came with Bouquet Day, so there was lots of information in the Luganda news, Uganda newspapers, and hopefully it encouraged domestic tourism to Bwindi as well. She also helped to launch our strategic plan, our latest strategic plan, 2024 to 2028, and then we also had a roundtable discussion, which included Dr. Patrick Katemnide, Dr. Peter Appel, and others from Ministry of Health to look at how do we get One Health to be more ingrained in day-to-day work. For example, should all community volunteers, village health teams become village health and conservation teams all over Uganda? Because it's not only a problem around national parks, but you know, the swamps and everywhere else. So we had discussions like that. And One Health has become such a big, so important now, that a certain One Health champion, Dr. Fabian, got the 2020 UNEP Award, and I got the 2021 UNEP Award. So we're glad that health is now considered important in conservation. And I kept saying that we need more local champions, because they will be the decision makers. And I'm very happy that Bugoma Forest Reserve has now become a national park. Congratulations. Excited to have been on the BBC 100 Women list in the climate category, because now they considered One Health as a way of promoting climate action. Glad to have written a book, actually very excited to have written a book, which was endorsed by the late Dr. Jane Goodall. This was her last visit to Uganda. Tendo happened to be with us, and he's in this photo with her. And she was very excited to get her own copy that I've signed. And she's really inspired so many of us, and may we continue her legacy. So this book is available all over the world, including in Aristoc as well, and Mahiri. And so I'm ending by saying that all this good work that's being done is being seen around the world, and important media platforms like CNN are featuring us and trying to see how what we're doing as a best practice example in Uganda can go around the world. So over here, CNN did a film, Kings of the Forest, showing us going to the gorillas with the rangers, and interviewed various people, the community conservation warden, the rangers, and me. And I'm sure you all saw it on Call to Earth. Indigo, since he's accompanying me today, he wrote a book, Zookeeper for a Week, thanks to Nguzi, who let him spend a week at the zoo. And he turned it into a story. He did this experience when he was 13. He turned it into a story when he was 16, and he won an award in America. And I thought I would end with this photo because his favorite part was feeding the giraffes. And I think it's a good way to go into the launch of the Giraffe Action Plan. Well, thank you so much for listening, and can continue to learn more about our work through our platforms. Thank you.
Another hand clap, a thunderous one to our keynote speaker. Thank you so much, Dr. Gladys. Do we have any questions before I allow her to go and sit? Let me get someone. Captain, a second. I was very excited about the giraffe in Kidepo. That story was my key take home. Kidepo with the 6. And now we have how many? Kidepo. Simon, how many do we have? Wow. Yeah.
That's fantastic.
Yes, Captain, please. Oh, thank you.
Was fighting seriously it is in the 80s when Gladys had just joined Uganda National Parks, not UA. And Eric Edroma, my ED, had gone out, and I was now the acting ED. And a young lady, tiny, without breasts, comes to my office and asks for permission to go to Marshall Falls. I looked at her and said, now this little girl, you want to go and do what? And but sir, no, she was so young, sir, and I was a boss. So I want to go there, and the giraffes have caught scabies, something that was itching them. And yet her mother had warned us, me, keep this girl. If she gets into problems, I will hang you. May her soul rest in peace. So I told this girl, you little girl, you go. So I called the chief warden. Who was the chief warden? I called the chief warden on radio call.
It was John Bosco Nue.
John Bosco Nue. There is this little girl who has insisted she wants to come and fight, treat the giraffes. And the giraffes were in the northern bank where Konyu was. So she went. They delayed on the way. I started panicking in my office. And everybody was seeing me, executive director, pacing up and down, asking Bosco, has Gladys arrived? That not yet. Now when it reached 9 o'clock, my wife started asking me, why are you going to the toilet all the time? I said, I have a problem with the little girl, the daughter of Rhoda Kalema, whatever Rhoda Kalema. She has decided to go, and I think she has had a problem. Later on, when I asked Nue, at around coming to midnight, Nue told me that now she has finally arrived. Then I breathed. I told my wife, now serve me also some food to eat. Anyway, to cut a long story short, I wanted Gladys to tell us that stories so that we know how giraffes have survived in Murchison Falls through her effort. Because they were all going to be wiped out because of scabies. Thank you.
Since my chairman talked standing, so I will copy the practice. I want to thank you, Gladys, for not only your wonderful talk, but also the wonderful works. And what I've realized, when you talk the walk, you saw everybody quiet and listening. Thank you. And to the young ones, emulate that example. But the second other perspective I want us to learn from you is that you've been documenting. So many stories go untold. And I want to encourage others, and possibly for these people to always give opportunities and identify those who have such walking and talking stories because they are motivational. But one thing that has made me stand up is to talk about the lesson all along. And it's quite unusual that when people talk, they begin with a lesson. So Dr. Kalema began with a lesson, and she made the conclusions later. And the lesson was translocation works. Having learned that, and you being in primatology for quite some time, one of the biggest challenges we have is about chimpanzee in conflict. They are in Mwende, they are in Mhororo, and elsewhere in the corridors because they have been cut down. The problem is growing day by day. Do you think it's time to translocate them? And that translocation works, and will work for them. Thank you.
Shall I answer those two first? Thank you so much, Captain Otekat and Mr. James Biamukama, for the great questions. I know you're veterans in this field, and you've seen us in various stages. So, Captain Otekat, the giraffes, what happened is when we got there, we found out that all the adult giraffes had that scaly patches on their skin, but they all looked healthy. You know, they had a good body condition. The other giraffes didn't have it. It was mainly affecting male giraffes. So when I consulted with other vets like Dr. Richard Koch, he told me they had seen it in Zimbabwe as well. And we attributed it to the fact that, remember, in Murchison there was a lot of poaching. In the days when you were flying there in the helicopter, I know you, in your small aircraft, you showed us a photo on the Honorary Warden's Forum when you were looking very young. And you were a pilot, and you flew with the late Ian Douglas Hamilton. Those days there was so much wildlife, and all the areas were not bushy because the elephants were putting down all the vegetation. This time around, Murchison was very bushy. So we thought that it could be favoring certain flies which are laying eggs in the skin of the giraffes. Because the chief warden took me around, and we thought maybe let's not try and treat them with ivermectin, because even if you do, within a few months, they'll have it again, as long as these flies are there. The better thing is to see how to change the ecology of the area. So that's what happened. That one wasn't as fatal as the one of the gorillas that actually ended up being very fatal. Yeah, with the scabies. So that was what happened with the giraffes. I think, do they still have those crusty lesions? Yes. So as it doesn't look nice, you know, but at least it's not affecting their health. I actually write about it in Walking with Gorillas, my book. There's some parts about giraffes and elephants as well, because a lot of those lessons can be carried across different species. And then Mr. James Byamukama, thank you for the great comments. I would say that, yes, it's very good for people to document. I've written a book. Captain told me he's been writing for how many years? I'm waiting for that book. In fact, I was about to send you a message a few days ago. How far have you gone? How far is your book? Okay. And I'm happy to help you with the editing. It's a very important book. It needs to come out. It's very sad that our mentor, the late Professor Eric Edroma, did not write a memoir. Can you imagine how amazing it would have been? Yeah, so many people have stories about him, but imagine, and he was a writer, but he just didn't get around to doing it. So I'd please everybody here, if you have it in you, just write. And I know many of you do have a book in you. I'm glad that the former Chief Warden of Windy Nelson, in his retirement, he said he's going to be writing. And maybe Richard will do the same. And then, so James, you asked about the translocation of chimpanzees. Yes. And incidentally, your mentor, your patron, wrote so many books. I didn't believe she had written over 10 by the time she passed on. So she's a good role model for all of us. Chimp translocation is not as controversial as it looks. At the beginning, we always used to say, we shouldn't translocate animals. There was a lot of pushback with the elephants, and the giraffes, and everything. People even said, just make a national park. Because I was looking at my notes recently. I don't know, I happened to be looking at them, the notes that I used to write the book. And some conservationists, the old ones, were saying, make it a national park. That area of Luwero, can you imagine? And make it a national park. Can you really, it would have been nice, but Luwero as it is, how can you keep animals there? It's good that conservancy is now coming up. But in those days, it was unheard of. And so I have to say that orangutans have been translocated. They've been a big successful translocations of orangutans in Southeast Asia, in areas where they were cutting down trees for palm oil. So that really worked. You know, they managed to translocate them. Gorillas have been translocated more recently to the North Virunga National Park. They were taken from Grace, a sanctuary that had orphaned gorillas, because there's a lot of bushmeat trade there. And they took a family to Mount Shabirumu, because the gorillas there were almost all disappearing. We're also doing some work in Mount Shabirumu, and we've been to that area. Eastern Lowland. Yeah. Exactly. The mountain ones are harder. Yes, much harder to translocate. Yeah. Yeah, those were Eastern Lowland gorillas. Yeah. They're easier. Because mountains are in a family, and you try and go for one, the others attack you. It's much more difficult. Then the temperature differences, the dehydration, the eating, you know, like they are eating every second, so getting them where they are is very difficult. Getting them from high altitude to low altitude is a problem. Yes. So we haven't succeeded in those. Yeah. With mountain, it hasn't succeeded. And we shouldn't even be thinking about it. Yeah. Because the numbers are growing anyway. Yeah, I had that. I remember that time. And John, we're waiting for your book. Yeah. You have many stories, and that one shouldn't miss. Uh-huh. But I even heard someone saying that they wanted to move the gorillas to Tanzania. People in Tanzania wanted the mountain gorillas. Because they're seeing that they're making money. Aha. That's something we have to think about. But I mean, we have to tell people that it's not really feasible. So back to James's question. I believe chimpanzee translocations can be considered. I know that you're working hard to create corridors. Corridors is the first option. I know in Kasokwa, we tried to save that tiny little forest near Budongo. Never worked. Chimps were caught in man traps. I remember doing a postmortem on a chimp there with people from Budongo. It's terrible, Budongo Conservation Field Station. So in some cases, translocation may be the only option. And I think with chimpanzees, a bit like orangutans, because it's a mother with babies. Then they move in a community, but they're not moving in family groups. So I think chimpanzees would be more similar to orangutans. And it could be something that could be considered in the future as an option for chimpanzees as well. Okay, thank you so much. Mm-hmm. Yes, Eunice.
Yes, Gladys, thank you for all this, for the presentation. And I remember that time of the scabies, how we had to work very hard to get the community part involved and do that partnership.
Yes.
Now, in Bwindi, these partnerships have worked.
Mm-hmm.
And we've been able to address, in a way, to some extent, the human-wildlife conflict through the Hugo, even expanding tourism activities, and also even getting the this sector in the southern sector.
In Nkuringo.
In Nkuringo, where the gorillas used to range outside. Now, this question is not really to you, because my expertise is in community conservation. It's to all of us now. Can we have the model of Bwindi? Is it possible to use it in other areas? Because so many things have been tried. For example, in Queen, which flagship? Because in Bwindi it has worked because there is that the gorilla flagship.
Mm-hmm.
And we are able to get benefits to the communities, and they've changed. Because right now, actually, they are the biggest custodians of the gorillas. You cannot poach them in Bwindi. Because in 2002, there was a case where actually the communities themselves arrested the poachers.
Mm-hmm.
Now, can we use this model and pick like a flagship species in another park to maybe scale up the same model? It may not work in the same way, because we are failing to get one bullet solution to human-wildlife conflict in these other areas. So it's a question to all of us. Maybe at the end of the day, as we discuss, we might be able to come up with something that we can scale up to other areas using the Bwindi model.
Yes. Thank you so much, Eunice. I know we started in UA together with Eunice and Lily. Eunice was in community, Lily in tourism, me in vet. 3 women. Those days there were very few women in conservation, so we were strong women, would fight with the men successfully. Uh-huh.
Yes, because I was the first deputy director, field operations. And I think there's, in the records of UA, I don't know if there's any other woman field operations director.
Yes.
It's a very tough job. You know, at 2, somebody's calling you, there's a problem. We've got poachers. At 3, you're being, so my phone was all on. throughout day and night. It's very tough, and somebody needs a solution at that time. And it is a very sensitive issue, and you must find a solution. I remember at that time when I set up the problem animal unit, it wasn't existing before. And the first translocation, the first problem we had was to deal with crocodiles. It was a big problem, and the first translocation of getting the crocodile from Mayuge to Machizon, I was so tense, like Mzee Tekat, because we had just trained the team with the crocodile. I've forgotten his name. He's used to be on CNN, so he had come and trained our team. So my question I had the whole night was, and they were calling now, the prayer, what do we do? Get another one, get another goat. So my problem was, if this crocodile escapes and eats this stuff, and it's me who deployed, how am I going to deal with this? But the good news is, it was successful, and from that time on, I think we have translocated, I don't know how many, very many. Yes, and so many other people have been trained. So, you know, yes, like she said, we are very tough women.
Thank you.
Yeah. Thank you, Dr. Kalema, for walking us through your journey. There is a powerful message I'm getting out of that. And I want the young officers to embrace it. Because when the only captain in this house allowed you to go to Kidepo, where there were gunshots the other day, I'm wondering what kept on motivating you. The young officers, you know, if you don't have the passion of what you want to do, surely you cannot move a step. Because sometimes, many times we ask, is there allowance? Allowance should not drive you to do your what? Your job. It is the passion that should drive you. And Dr. Kalema has made her presentation. I listened carefully. The other powerful message, you can't do it alone. Conservation, you cannot do it what?
Alone.
You do it with people. So, I know my brother Macomb is listening. She asked a question that has Queen Elizabeth National Park settled. I think we're on the right footage, but a lot is still needed. With that, I submit. Thank you.
And thank you so much, Dr. Robert Baluku. Actually, talking about that whole thing of allowance, I remember they would tell me there's a sick elephant, and I just had to go, because if I wait for the allowances from UA moving up and down the stairs, especially in the second office, you get there when the animal is dead. So I'll just call the warden on radio call. There was no I said, I'm coming. Captain says she's coming. Look after her. So I get there, he gets me somewhere to stay, they get me something to eat, we work. So I think that attitude of go and do the work and don't worry about allowances, I think we need to have it back. It needs to come back, because it's more important to get the job done, to make a difference for conservation, than to be thinking about things like that. Otherwise, we won't move. Thank you for that.
I think we are closing.
Yes.
And a question. Okay, that is the last question. We are running late to dive into the program. So Yampa, you're the last. I hope there's no one else with a burning one.
Thank you very much, Dr. Kalema-Zikusoka. That was, I was young. I think to me she was even younger. She came at UWake from London collecting data. She was the first person to take me to the gorillas in 1998. Took me up there, it was raining. But I have a question. That time and today, Bwindi National Park and Mugahinga have done so well on mitigating human-wildlife conflict. It is not 100%, but it is above all other national parks. You've done a lot of documentation of whatever you've been doing, Doctor. Is there a line that you've done, something that we can follow? Queen Elizabeth, Lake Mburo, Maction Falls. Kidepo's issue is different with the way I look at it, but I'm looking at those national parks. What can we borrow from Bwindi or from the work you've done that we can transfer to Queen Elizabeth? Queen Elizabeth rate at human-wildlife conflict is so high that it is not documented because the people involved are so big that we fear to talk about them. You get it? But those big people, if something can be turned around and they are used to talk about, used to mitigate it, but what line can we use that we can borrow? That's the main question. Thank you.
Thank you, Yampa. That's a very good question. And I think
maybe because this was the last person.
Yes.
But I want to chip in.
Dr.
Yes. Just to thank you. I think my story in wildlife, the first darting, the person who trained me to dart, actually is that one standing up there. I remember the way he used to tap my shoulder and say, go slowly, have confidence, and shoot. You know that gun, I can even fail to shoot this head here, very close to me, unless you are taught the techniques of how to do it. Thank you very much. And followed by Dr. Margaret. These ladies are very tough, and they're the ones that taught me here. The first. Thank you.
Thank you so much, Dr. Nyel. And I know that you've trained so many other vets after that. If I tell you a funny story, I was pregnant with Indigo, this baby here, this tall boy here. And remember when we were in Agre said, no, we have a young vet. I want him to come with you for the African swine fever study. And remember, we got to Murchison. You know, we're moving around. The baby's getting bigger and bigger. We came from Queen. You know, the belly just keeps getting bigger and bigger. And we tried, remember that baboon? We went to look for bananas because I was craving for bananas. And the women here who've had babies know what I'm talking about when you're craving. And there was hardly any fruit. We were staying in the student hostel. And we went outside. We got bananas in Pakuba village. We came back, and guess what? We just left them there, went to the bathroom, came back. The baboon took all the bananas and left only one. Those were the days. But we managed to dart the warthogs, the Uganda corb, and Dr. Eric was very motivated, and we're very proud at how far he's come, and now being a chief warden, and you're a great inspiration. And you're humble. Yes. Thank you so much. Now, Yampa, I didn't have time to talk about it in the presentation, but we did do some work in Queen Elizabeth. Again, implementing the One Health approach in a savanna ecosystem. So in that case, the Basongora care so much about their cattle, so much. So we use that in order to help them care more about wildlife. So we started to improve the health of their cows, working, and we created community conservation animal health workers. So just like with the Ministry of Health, we added conservation to the VHTs. Here we added conservation to the community animal health workers who UVA doesn't really recognize them, Uganda Vet Association, but in areas where NGOs are like Karamoja, Food and Agriculture Organization, Oxfam, you can't work without them because the vets, there are not enough vets to go down there to treat people's animals. So we created that system, and these community animal health workers did a lot. They even rescued baby elephants. Some are at the zoo. Hamukungu was rescued by these community animal health, conservation animal health workers. And the chief warden at the time, Nelson, said, wow, in their crude way, they wrapped this baby elephant on a boat and rescued it because the mother had abandoned it or she had lost the baby. So, and one thing that they did is whenever I would go to take samples from cattle, they made everybody feel safe and they joined us. And even when we went to collect samples from buffaloes, they said, can we join you? And they did. And they're very good with animals, by the way. They wanted to take samples, they wanted to inject. They actually like animals. And we realized that they like animals, so if they can like livestock, they can like wildlife. And there has to be a way that we can work together. So we made some progress with the Basongora. We created 60 community conservation animal health workers. During the anthrax outbreak, they discouraged people from eating meat from animals of unknown sources. They helped with mobilizing cattle for the vaccinations that Ministry of Agriculture was giving while UWA was burying the dead hippos. Whereas before they were cynical about vaccination. They said, you're vaccinating our animals, you want to kill them. But now they started to start to understand the importance of vaccination. So I think you meet them where they are, and the One Health model can really work in Savannah. We tried it a bit in Pianupe as well, and we got the Karamajong, about 10 of them became part of that community conservation animal health worker with funding from the French government. It was a one-year funding. And then UWA took them up as some of their wildlife scouts. And so there is a way that you can work, but it can work in savanna and forest ecosystem. So I think One Health is one approach that can really help, but also making sure that the benefits from tourism reach the communities in whatever way. You know, whether it's buying their crafts, employing them, the communities have to feel the benefit of why should we not poison a lion? Because the lion is helping me to have a better life. And how do we make that happen? That the lions become so important to the communities around Queen Elizabeth that they would not even think of poisoning a lion. And if someone does it, they'll be the first one to arrest them or report them to UWA. So I think we need to get to that level. Yeah, thank you.
Thank you, Dr. Gladys. Another hand clap. A third last one. When you get many questions, you know your talk was very interesting. I still had a question for Captain. Why were you looking at doctor's chest? Huh? Captain. Captain emphasized she had no nyonyo. Captain. The girl child has suffered as we dive into the giraffe conservation. The girl child has suffered. Welcome back from UBC, Mr. Makombo. In your absence, the Chief Warden of Giraffe Conservation Area welcomed the members and opened this. This is not a launch of the Giraffe Conservation Action Plan. As I said at the beginning, we are reviewing the actions we put in place way back to see how far we have gone. I just love that love, you know.